Welcome, everyone, to today's presentation, Measuring and Responding to Risk and Needs Factors in Practice. I'm Susan Howley, and I am a staff member here at JRSA. We're delighted that you could spend time with us today. This session is supported with funding from the Bureau of Justice Statistics, which is part of the Office of Justice Programs at the U.S. Department of Justice. But the views expressed today are those of the presenters, not necessarily the Department of Justice. And now I'd like to ask our discussant, William Sabol from Georgia Tech University, to say a few words about this session. Bill?
Hi, this is Bill Sabol. I'm actually from Georgia State University, not Georgia Tech, but we're neighbors, so that's okay. Echo Susan's welcome to the panel. I'm looking forward to this panel, which consists of 3 presentations based on empirical work that all fall within the evidence-based or problem-solving orientation to criminal justice programs. The general topic, according to the title, is Responding to Risk and Needs Factors in Practice. And one of the things I found interesting about the presentations is that each of them covers or addresses one or a different dimension of that broad spectrum of risk and needs in practice. Our presentation is going to start with one from the Criminal Justice Coordinating Council, or the SAC, in Georgia. And they're going to be talking about determining offender risk and needs with LSIR versus DIU RANT, 2 different risk instruments. And what I find interesting about their paper is one question about whether a general instrument like LSIR performs as well or not as well as an instrument that's designed to address the risks and needs of a specific group or a specific type of court program like a DUI court. Then that'll be followed by a presentation from the Iowa SAC looking at a juvenile justice decision-making matrix. And this is pretty interesting because it arrays risk with needs, and in the matrix identifies various responses, both in terms of rewards or sanctions that should be provided or given based on behaviors of people in different risk categories. And it aims to get at the effectiveness of that matrix in addressing recidivism of juvenile offenders. And the third presentation from Illinois, and Jessica Reichert will report the results of a survey of probationers in Illinois that I also found really interesting because it's trying to assess the extent to which they practice treatment versus sanctions in the administration of probation. So I don't want to take up any more time with this introduction, except I guess I turn it over to Sam Gonzalez from the Georgia SAC, who's going to present on the LSIR and DUI RANT. Sam?
Hello, everybody. How are you today? All right. Hold on. My name is Sam Gonzalez. I'm the Research and Evaluation Program Director of the Georgia Statistical Analysis Center, and I'm really happy to be here today to discuss our work around the DUI RANT risk needs assessment that we completed for the Georgia Council of Accountability Court judges. So first off, I'd really like to thank JRSA for hosting this webinar following the cancellation of ASC, ASC annual meeting. To say the least, I was a little bummed since that was going to be my first time ever presenting at ASC, and I think our SAC as well. But I am very thankful that JRSA organized this discussion and that it's still taking place in light of what's going on in the world today. And I really hope that everybody finds it informative. I love hearing from my colleagues from around the country and the work that they're doing. So today I'm going to start with a little bit of background information that kind of helps you understand how we got where we were at. And before we go into the analysis. So since 2013, the leaders of the state of Georgia have been enacting a series of criminal justice reforms throughout the state. And as part of those reforms, it was decided to use state funds for grants to expand the number of accountability courts in the state or increase the capacity of existing accountability courts. And as a part of that process, the Georgia Council of Accountability Court Judges are also what we call CACJ, their acronym, was created to guide the accountability court grant award process, monitor any court progress, and encourage best practices in serving the particular target populations for the court. So currently, Georgia has over 160 accountability courts, which include adult felony drug court, mental health courts, veterans courts, family treatment courts, juvenile courts, and the target for this analysis are DUI courts. And it's a part of what we credit of reducing our need for building more jails in the state over the past decade. So as you can imagine, the Georgia Council of Accountability Court Judges had many research and data needs to fulfill their organizational mission, which created an opportunity for CACJ to fund an analyst within the Georgia SAC to conduct research and data collection. So we're going on 2 years of having a full-time analyst dedicated to working with the Council of Accountability Court Judges, and really that was key for making this research come to fruition. And because we had somebody really accessible to the Council of Accountability Court Judges, it was very easy for them to come to us with a problem to try to find an answer. And so the problem that the Council of Accountability Court Judges had was that they had approved the use of the LSIR, which is the Level of Service Inventory Revised Risk Needs Assessment, to identify and place participants in various accountability court programs throughout the state of Georgia. And then although the LSIR is a validated tool for assessing risk and need for offender populations, accountability court practitioners were concerned that it was imprecise in capturing the risk and needs of repeat DWI offenders. So CACJ was interested in adopting the DUI rant assessment tool as a viable alternative to the LSIR to more accurately identify risk and need with DUI court participants. So there is actually 2 DUI court judges, one over the Metrics and Measures Committee looking at how they collect data, how they report data, their risk needs assessment, and so forth, and one over the funding committee of the Council of Accountability Court Judges that were introduced to the DUI rant assessment tool just kind of through their continued education as accountability court judges, and made the decision to pilot the tool with CACJ in 14 of the 25 or 23 DUI courts in Georgia. So that kind of sets you up to how we got here. So we weren't looking for our research to identify the best tool for the DUI course. Really, we were asked to look at either the DUI rant because the judges really liked it already, or the LSIR because that's what CACJ had already adopted. So, and so before determining whether the DUI rant would replace the LSIR for DUI courts in Georgia, the CACJ Funding Committee asked that we do an analysis to evaluate what tool would be better for them to implement for DUI courts. And so it was kind of funny because when the CACJ came to us and asked if we could do the evaluation, at first, I was spitballing ideas with my boss, Stephanie Lopez-Howard. She's the director of our Statistical Analysis Center. And man, we were just like, I don't know, I think we might be over our heads with this. And we kind of felt like this request was a little too much for us to handle. We've never validated an assessment tool before. And this is something we would typically contract out to a research partner, like our partners at Georgia State University or partners at Applied Research Services. But I remember in our conversation kind of stepping back and realizing that validating the tool wasn't necessarily what CACJ needed. They needed us to see if the tool is going to meet their needs as a screening tool. This validation was already done. So the judges had already decided the tool worked at identifying risk and need. And with this, we came up with 6 research questions that we hope to answer through our analysis. And essentially, we wanted to look at how these assessment tools differ and how would things change by using these different tools. To accomplish this, we created this methodology. So first we reviewed the LSIR and DUI rant tools. Reviewed court policy and procedure manuals. So the Council of Accountability Court Judges requires all accountability courts to document their processes in these policy and procedure manuals. And we use that to identify where the courts had stated they would use a risk need assessment. We conducted semi-structured interviews with court coordinators and with some treatment providers. And we asked that the courts randomly assign the use of the DUI rant and the LSIR within the DUI courts. To get at efficiency issues, we conducted a time and motion study with the courts, and of course, analyzed administrative data. This included CACJ, DUI court data, LSIR assessment data, the actual assessment data from the DUI rant, and computerized criminal history as well for our analysis. So in our initial review of the two tools, we found that the LSIR was just way more cumbersome than the DUI rant. The LSIR consisted of 54 questions. And because there was 11 scoring items where the interviewer had to score between 0 and 3, it required additional questions to be asked, a lot of times probing questions to assess where the offender may fall on this scale. And so, even though there's 54 questions, many times the interviewers were asked to ask many more questions to get down to the nuts and bolts of what's going on there. And it just didn't seem like a screening tool because it took a lot of effort. The DUI rant, on the other hand, was very short and could be administered very quickly. It was 23 questions, mainly numeric, 8 yes and no items, just one scored item through 1 through 5. And its primary focus was on substance use and criminal history type questions. And so to look at the differences between the tools even further, what we did is we saw that the LSIR questions were categorized by 10 different domains or question types. And they're all listed on the left-hand side of this chart. And what we did to compare the DUI rant to the LSIR is that we fit all the DUI rant questions in one of these domains that the LSIR had. And so what we found was that the LSIR was very spread out. There's a lot of different types of questions in that assessment. You can see, there's a couple questions on leisure and recreation. There's a couple questions on financial. Nothing on demographics that's unique to the DUI rant. A few questions on attitudes and orientation, but the DUI rant was much more streamlined. In effect, really, there was only 2 of the domains that the LSIR questions fell in that the DUI rant really focused on, and that was alcohol and drug problems and criminal history. So 39% of the DUI rant questions fell under identifying alcohol or drug problems or identifying some sort of criminal history. Even though there was 6 different domains that the DUI rant kind of looked at, they really fell in just these 2 domains. And below there too is our time and motion study findings. We found that the LSIR took about 27 minutes to complete and about 17 minutes for the DUI rant to complete when they're assessing DUI offenders coming into the court. And so this incidentally also brought up red flags to our partners at CACJ because their understanding of the LSIR was that it should take longer than 27 minutes, and the kind of general consensus that they came up with was that maybe the courts were kind of blowing through the LSIR. And we'll kind of get into maybe why we think that's the case in just a minute. To get into the domains, I'm actually going to skip this substance use one. I'm going to focus on the criminal history domain. These are the questions that really focused on criminal history, and this is where you can really see the difference between the LSIR and the DUI rant, other than one being shorter and one being longer, right? So with the LSIR, the criminal history domain, there are 0 items asking about DUI conviction, history, or moving violations. Questions about history of assault and violence are present. They ask about prior incarceration. The LSIR asks about your conduct during incarceration. And those types of incarceration questions just aren't present with the DUI rant. 5 of the 8 items specific to the DUI rant are specific to DUI convictions and moving violations. 2 items are focused on other types of arrests, but that's it. They do have questions about age, both tools, but it's really focused in on that DUI offender. So, the criminal history domain is really where you can see that the LSIR was normed on a prison population as compared to a DUI offender-specific population. So next we looked at DUI court policy and procedure manuals to determine the general eligibility screening criteria for Georgia DUI courts. Through our analysis of the policy and procedure manuals, we found that the LSIR is currently not being used to determine high risk or need, and courts generally follow accountability court legal standards to determine high risk for eligibility. So these legal standards are set by CACJ, where if you have 2 DUIs in 5 years and 3 DUIs in your lifetime, you're considered high risk and eligible for the DUI court. So what we found was that the LSIR is not being administered until the DUI offender has been accepted into the program during either orientation or the beginning of treatment. So it wasn't being used as a screening tool at all. So we found that it played no role in determining DUI court eligibility. And this is in a contradiction to what the CACJ thought they required and expected from all courts, but did not realize that maybe the language in the DUI court standards was helping drive the decision not to apply the LSIR until after the DUI offender was accepted into the court program. But through our interviews, we find there were some other issues with the LSIR that caused DUI court practitioners not to use this as a screening tool to determine eligibility for the court. So our interviews with the court coordinators and the treatment providers confirmed what we found with our initial review of the tools. The LSIR had more questions. This is what they expressed to us in our interviews. It was harder to administer, so they typically reserve the LSIR for treatment providers because it requires some training to apply. The LSIR had a broader focus of measures that practitioners didn't feel or don't feel that work well with DUI offenders. And in contrast, the DUI rant was streamlined. We felt like anybody could administer it. It was easier for staff to administer and had a narrower focus on substance use and criminal history. And this, connected with DUI court practitioners. This resulted in increased confidence by court staff in the DUI rant scoring and expressed broader use in the screening tool to identify high risk and high need. So currently at this point, they didn't see any use for the LSIR, but the DUI rant, they did. And this was confirmed with the data that we collected, the actual scoring of the 2 different risk needs assessment tools. So we asked that the pilot courts randomly assign the application of either the DUI rant or the LSIR to court referrals. This resulted in us being able to look at the data and compare the scoring between the 2 groups to see if there was any differences, and there was a big difference. And although the scoring is different between the 2 tools, apples and oranges, the tools placed offenders in 1 of 4 similar types of categories of risk and need. So if you look at the charts here, on your left, I believe, is going to be the DUI rant. On the right of your screen should be the LSIR chart. So what we found is that nearly half of the offenders assessed by the DUI rant were identified as having high risk and need. And in contrast, none of the offenders assessed by the LSIR were identified as high risk and having a high need. So technically, nobody assessed by the LSIR should be going to the Georgia accountability courts because they want to focus on high risk and high need. 75% of those screened by the DUI rant met the state standards of high risk. That was the 2 in 5 or 3 in a lifetime DUIs. And so this confirmed that the lack of confidence in the LSIR scoring by court staff, and that there may be some offenders with low risk and need entering the DUI courts based on the legal criteria, and they shouldn't be, which we found to be very interesting. To get at efficiency, we had to look at costs. And I'm not going to go deep into the cost analysis, but we did find that the cost of the DUI rant was significantly cheaper than the LSIR. What was interesting here is that we took into consideration staff time through a time and motion study where we applied the average hourly salary of a coordinator to capture the efficiency savings. So if you take into consideration just the difference in cost between the two tools, there's an estimated savings of about $1,700. But this increase in additional savings, but there is an increase of additional savings of $2,700 if you take into consideration staff time, which totals to be about $4,500 of savings by switching from the LSIR to the DUI rant. So, you know, a lot of people don't see, you know, $5,000 in a huge, you know, $1 million budget as very important, but specifically with the budget shortfalls right now, any little bit helps when you're working on your budgets. So in conclusion, the DUI rant is a very effective screening tool for the DUI or the Georgia DUI courts because of its ease of use and the confidence the court staff have in it to identify high risk and need DUI offenders. It has been proven to be helpful to identify low risk and need individuals that may have been referred to the DUI courts through that legal standard and shouldn't have. This is also important, or this tool is also important in the justification and track placement or the development of different tracks within the DUI courts to make sure that low risk offenders are not placed with high risk and high need offenders. This is just outlining best practices. With this, the cost savings resulted in the CACJ adopting the DUI rant as their new risk needs assessment tool, and we're hoping to do a longer term analysis to see how outcomes may have changed for these individuals as well. Well, that's it for my presentation. Now I will be passing it off to Kathy from Iowa.
Okay. Hello, everyone, and I will add, Samuel, thank JRSA for creating this space for us to talk, so I'll add my thanks for that, and also feel compelled to share that I'm feeling quite thankful today because it's about 70 degrees here in Iowa, which is pretty unusual in November, so those of us who are in the Midwest are feeling pretty good about our weather today. My name is Kathy Nestby. I'm an executive officer with the Division of Criminal and Juvenile Justice Planning for the state of Iowa. And our agency carries out research, policy analysis, program development, and data analysis activities to assist policymakers and justice system agencies in identifying issues of concern and to improve their operations and effectiveness in both the adult and juvenile justice system. One of the ways we've chosen to accomplish that work is through the use and development of data-driven tools in juvenile justice, including the decision matrix, which we'll be discussing briefly today. I'll be giving you a brief overview, kind of some background and a look at the tool itself, and then I'm going to pass things off to my coworker, Jeff Regula, and he'll talk a little bit more about the data related to the decision matrix. In short, the decision matrix is a type of structured decision making which uses historical data to determine the level of supervision and the intensity of services that are likely to be most successful with youth in the present and future. So we're taking a look at historical data and then trying to predict what will work best for the kids that are currently being worked with, and of course any kids that will be worked with in the future, with the intention to maximize the potential for recidivism reduction. So really that's the intent of the tool, and in broad strokes, how we approach designing the tool is by taking a look at that historical data. The development of the tool was based largely on the model that is used by the Florida Department of Juvenile Justice, and it was with the assistance of those researchers who created the Florida model. And I will put in the comment section, I have a name of a publication that I think might be helpful for folks to take a look at. So as soon as I'm done here, I'll put that in the chat box. Early on, we also engaged the assistance of juvenile court officers from each of the judicial districts around the entire state. And that largely was to parse the Florida tool and see how we might tweak it really to become more Iowa friendly. And also, and you'll see this when I show you the tool itself, to talk about what those juvenile court officers were currently doing in terms of level of supervision, intensity of services. So really just getting that firsthand input from the folks who are going to be using the tool. More recently, in about October of 2018, our agency seated a multidisciplinary team of subject matter experts for the final development of the tool and prior to piloting the tool. And I guess I really just want to emphasize how important it was to seat that team. And, you know, as early on when we pulled juvenile court officers to work with us, that was one thing. When we sat the multidisciplinary team, we included, of course, juvenile court officers. We also included prosecutors, public defenders, judges, those who would have, you know, the most likelihood of coming into contact with use of the tool or being able to use the tool themselves or benefit from the tool. And those, you know, I guess for anyone who's considering creating a tool like this for themselves, I can't stress how important that would be to seat a team like that and to get that sort of engagement. In the meetings that we had with those team, we had, you know, extremely in-depth conversations about the tool and really just juvenile court processing, period, and you know, how it all related to the ability to effectively use the tool and, you know, just the nuances of a lot of different things. So they were invaluable, I would say, you know, in terms of important part of creating a tool like this for yourself. So I can't recommend that strongly enough. And as I mentioned, we are piloting the tool in 2 local jurisdictions. And data collection for that began in September 2019 and is ongoing. And that's what my coworker, Jeff Regula, will be discussing when I pass things off to him here shortly. And as we review the data that we've been collecting during that pilot, adjustments will be made to the tool as necessary. And once the tool has been fully validated as accurate, the intention is for it to be used statewide. And we, of course, would develop training and you know, soften the ground for the use of the tool statewide. Because, of course, one of the things that we ran into throughout the process, you know, but certainly early on, as we've been talking about developing this tool, is some resistance or concern, maybe is more friendly way to put it, on the part of practitioners who wondered if this was going to be the sort of thing that took away their ability to make decisions. You know, was this going to be something that dictated to them what they had to do with kids? And we have made every effort to reassure folks in Iowa that would be using this tool that it is just that, a tool. You know, it's not intended to subvert or replace the decision-making abilities of anyone that's directly engaged with working with juvenile justice youth. It's intended to assist them, to provide them with information that they might not otherwise have. So I'm going to go ahead and show you the tool here, the tool itself. And really it's very simple on the surface of it. It's just, there's a second page here, but it's short, I guess, maybe is the best way to put it. There's a lot of complexity behind it, but the tool itself is actually quite easy to use. So despite the fact that a lot has gone into the background of it, the use is quite simple. So what you'll see here, and it's still, of course, in draft form because we are piloting it, and we'll make changes if we find that becomes necessary. I do want to share at the top here, you'll see the Iowa Delinquency Assessment Risk Level. And, and obviously this whole day is, partially to be talking about risk level and the way all of us use it. And the Iowa Delinquency Assessment is Iowa's validated risk needs assessment instrument, and it's been operational since 2007. We've had it in Iowa. And it is used to determine youth risk level as well as to assist with case planning. So it's a two-part assessment tool. The short form is what gives us the risk level. And then we also have a long form that's geared more towards needs and is used for case planning. So it has different need areas, that can drive juvenile court officers' decision-making in terms of what type of service a child might be in need of. For purposes of the matrix, we use exclusively the short form or the risk level result. And along the horizontal axis of the matrix at the top there, you'll see no risk level, low risk, moderate risk, or high risk. And the low, moderate, or high are the Iowa Delinquency Assessment, or the IDA, as we refer to it, the IDA levels that exist currently. So the two axes that we use to determine the boxes, the level 1, level 2, level 3 that you see there, are the IDA risk level, and then the most serious active offense is what you'll see on the vertical axis there. And really, that's exactly, how it reads. It's the offense that is the highest or most serious offense when the kid walks through the door of the juvenile court officer that they've been referred to see. So those are the two different axes that determine what level of supervision or service that the child would most likely benefit from. And you'll see there's multiple levels in some of the different boxes. And within those, and granted in the time frame we have, I can't necessarily go into depth about how all this works, but there are optimal choices, there are appropriate choices within the box. And then if you go outside of the box that's determined, then you're going above or below recommendation. So I'll come back to this screen to refer to, but I want to show you what those different levels are. Excuse me. And the bold that's right next to the level 1, level 2, that is the level of supervision that the child would be receiving. Those things that are not bolded but are listed underneath each of those levels are the services that are possible for the child to receive. So they wouldn't necessarily be receiving each and every one of those services. It would be more like a menu for a juvenile court officer or the court to choose from in terms of what's appropriate or what are the most appropriate options in terms of intensity of service. So if you kind of take a glance at them, and some are unique to Iowa, but mostly they're going to be things that are familiar to you. But if you look through that list, you'll see the increasing type of intensity in those services. So I'm going to return to the matrix itself. And I want to just before I hand it off to Jeff here, I just want to draw your attention to some of the notes below there, some of the things that are not included in the matrix. So for example, anything that involves evaluation. So if I'm a juvenile court officer and a child comes into my office under any given charge, and I determine that it's necessary for that child to have an alcohol and drug evaluation, that's not something that's going to be reflected in the matrix, because an evaluation is something that you may need regardless of your risk level and regardless of the active offense that you have. So that's something we consider to be a universal option and why it's not included in the matrix. A couple other notes, we have a separate tool that we use for detention decision making, and that's actually already in the field. So anything that is detention decision making related is not included in this decision matrix. There's a separate tool for that. And two other things, and you'll see them at the bottom there, that sex offenders, and Jeff, I don't know if he will mention this or not, so I'm sorry, Jeff, if I'm stealing your thunder at all, but the sex offender group doesn't really fit well, you know, in terms of level of supervision and intensity of services with the other kids that we're studied for our purposes. So really our recommendation is that, you know, for any juvenile court officer or court staff that's using the tool, that they, you know, really have to probably take a closer look at those kids and not necessarily rely quite as heavily on the decision matrix for their information. And then finally, any type of program or service, you know, for our purposes for the matrix here, that comes pre-charged. So, you know, if we have law enforcement who choose to send a kid to a program rather than make an official referral when they've held a delinquent youth, then that's not something that would be included in the matrix. And that's largely because we don't collect data on that at present in Iowa. We, all of the data that we use comes from kids that have been referred to juvenile court services. So anything that would happen prior to that referral, we could not reasonably make recommendations as to what would work because we didn't have the data to draw from. So that's your brief overview from me, and I'm going to turn it over to Jeff Regula now, and he's going to talk to you a little bit more about the data.
Okay, well, thank you, Kathy, and welcome everyone. My name's Jeff Regula. I'm the statistical research analyst with CJJP here in Iowa. I'm kind of stepping out of my normal box today, and this presentation really doesn't have a lot of numbers and charts to share with you. So I thought it might be more interesting to kind of talk a little bit more about some of the process and what we did with the data. Here in Iowa with the Statistical Research Center, we have access to a fairly rich database that we can draw on that consists of both the information from the court information system that covers complaints and outcomes of court trials and that sort of thing. But it's also tightly integrated with the juvenile court services case management system so that we can combine that information together and sort of look at how those juvenile cases are handled from the time they first come in contact with the system right through their services and completing that information. So I think as Kathy mentioned before, there were sort of two major groups that came together to look at this and help us sort of slot everything into the decision matrix. And there were, to go with that, sort of two major data analysis efforts that were made. In the first effort, it was really a review of the services and placements. We looked at cohorts of data based on whether or not children received services and what their service types and placement types were. We have about 50 different codes in the database that can break those services out, and you saw some examples of those in the table here that sort of shows how they were then broken out and fed into the matrix. So as you can see, we get a fairly wide range of services covered in that. Those cohorts were broken down. That information was then served with shared with the juvenile court officers who helped to put that together and sort of guided how we built the matrix from there. Then in the second round, when we established the new panel, we took a deeper look into the data, and we actually developed some longitudinal data and looked at a series of exit cohorts of cases for about 5 years worth of cases that exited the system. In both cases, we used recidivism, which was defined as a new complaint that occurred within 1 year. In the case of the services, it was after service completion. In the case of the episode data in the second analysis, that was from the episode end. Then for that episode data, we looked and identified the risk level of participants when they first entered the system and what that first complaint was, so that we could sort of divide them into the boxes that had been formed into the matrix. Then we looked at all of their service and placement data while they were involved and identified their supervision levels. All of this information was then fed into a series of probability models where we used logistic regression and tried to predict the recidivism for those cases. And that resulted in basically one model for each box in the decision matrix, so we could break down and decide sort of which, for each of those areas, what was sort of an optimal level of supervision and what services were most effective. Some of the results that sort of came out and helped us guide those from those two analyses. First, in looking at the review of services and placements, we found that lower risk use had lower recidivism rates. It was kind of interesting to see, though, that those who did receive services were about 3 times higher if they were low risk to recidivate. And similar for moderate use who received services, they were about 2 times more likely to recidivate. The high risk didn't seem to vary a whole lot based on whether or not they received services, and those who were coming out of placements had higher recidivism rates overall. Then when we started to take a look at the episodes of care, some of the things we really found that helped guide things were that those low-risk youth who had simple misdemeanor complaints did their best whenever they were dismissed or diverted. The use of informal supervisions tended to cut in half the risk of recidivism for high-risk youth with the simple misdemeanor complaints. Those involved in the system, basically, as you got more involved in the system, your recidivism tended to increase. It was also important to note that when you got into like the felony and high risk or the nonviolent felonies, we really didn't have a lot of data to help guide what we were doing there. Then when we thought about services, the diversion and substance abuse services were lowering the risk of recidivism, and that the provision of services is most effective at lowering recidivism in the low-risk violent felony cases, although that may be being distorted by the lower number of cases that we had in that group. In most of the other cases, the provision of services tend to increase the odds of recidivism. So that kind of summarized where we were at for some of the history that guided the analysis. So what we're doing with our next step in the pilot now is we're actually recording sort of that initial case and getting a better feel for what that presenting offense was. That was one of the difficulties we did have in pulling information out of the information system, since it's all more event-driven. Making that longitudinal data set proved to be somewhat challenging sometimes to really pin down what was happening when when the decisions were first being made to decide what to do with the kids. So we're now collecting that data. As Kathy mentioned, we're about a year into collecting that. And what we'll do is we'll take that data back and match it into our system and look at those recidivisms. We're probably some year or so away. So we've had about a year's worth of new entries into the system, but probably less than half of the 1,000 or so cases that we've collected so far from the pilot sites have completed an episode of care yet. Some of those may stretch out for quite some time. And once we have a sufficient number of those ended, we'll go back now and look at sort of revisit that whole thing and see where they fell in the matrix. Was the matrix recommendation followed or not, and what the outcomes were for those, so we can come back and revisit all of this and sort of refine that matrix and move toward the next step. So I think that kind of wraps up what we wanted to talk about here today. So I'm going to pass the slides on to Jessica, or I'm not sure who's going to handle that. And we'll hear from Illinois.
Hello. We have the answers slide. There we go. Hi, I'm Jessica Reichert. I am Acting Research Director at the Illinois Criminal Justice Information Authority. I realized I didn't put my name on the first slide. Oops. But I do want to thank JRSA for putting this together. What I'm going to be presenting on is not about risk and needs assessment tools, but drug testing, which is another kind of tool that can help guide services and sanctions. The Illinois Criminal Justice Information Authority, or ICJA, serves as the Illinois Statistical Analysis Center. My presentation will draw from a series of 2 articles available on the ICJA website. One is a literature review of drug testing, which will provide some background for the presentation, and the other is an article on the study itself of drug testing practices in the state. So research has found that 80% of probationers misuse drugs or alcohol, and a national study found probationers and parolees had diagnosable substance use disorders 9 times the general population. So drug testing is a very common practice in probation, but the limited research available offers no conclusive evidence that drug testing alone reduces recidivism or improves behavioral health outcomes. Holloway and colleagues in 2006 conducted a meta-analysis on drug treatment effects, drug testing effects on criminal offending. They found 4 studies on drug testing and found no effect on reducing criminal behavior. And then a 2014 systematic review on the use of drug testing for medical management of patients. Dupuy and colleagues found no clinical value in drug testing among the limited studies available. I noticed some of the black parts of the slide aren't showing up. So the slide will say positive drug tests may equal negative consequences. And these can include sanctions, technical violations, and revocations. The American Society of Addiction Medicine, or ASAM, put out guidelines and suggested drug tests should support an individual's recovery and not be used to punish them. So there appears to be a lack of guidance on drug testing, even though it's used so frequently. The American Probation and Parole Association last offered guidelines on drug testing in 1992. And ASAM, which is the premier association for addiction medicine professionals, they developed clinical guidelines for drug testing in 2017, and those should be in line with the non-clinical probation practices. And to develop their guidelines, they analyzed more than 100 studies and incorporated the views of multidisciplinary experts and scientific evidence. And then finally, in 2017, the National Association of Drug Court Professionals Adult Drug Court Best Practice Standards offered guidance on the practice of drug testing, specifically for drug court supervision. So the literature suggests, rather than testing all clients, that probation officers should ask these questions. Why am I testing, and what questions will the test answer for me? To best detect drug use, random testing should be employed rather than a predictable schedule. Also, the amount of testing can make a difference. Research has found testing 1 time a week yields a 35% chance of detecting drug use, while testing twice a week, an 80% chance of detection. But of course, more testing will increase costs and can put a burden on both staff and probation clients. So probation officers should test along with the discussion of substance misuse and self-reported information. Discrepancies between self-reported drug use and test results can be discussed, and sanctions should be for lack of effort and adherence to treatment rather than for exhibiting signs and symptoms of a substance use disorder. So there are definite limitations to drug tests. It won't create abstinence. It's not treatment. It can't diagnose a substance use disorder, which has to be done by a clinician. It can't offer qualitative information such as how much was used, for how long, and the circumstances around use. So it doesn't do everything alone. So overall, from looking at the literature, again, it's limited, but recommendations would be to have regular communication between treatment providers and probation officers, have a dialogue between the person conducting the test and the person taking it, awareness by all parties of drug testing policies and procedures, including what any potential sanctions could be. Avoid solely focusing on negative behaviors and sanctions, but also focus on positive behavior, positive reinforcements and rewards, and to use it as a tool for supporting recovery than exacting punishment. So now I'm going to discuss the study we did. I want to acknowledge my co-authors, other ICESA researchers, Lauren Weissner and Doug Otto. So we conducted an online survey in summer of 2019, and although that's really not that long ago, as we know, a lot's happened. The pandemic changed a lot of things that affect probation practices, including the amount of drug testing. It is, I'm assuming that, post-pandemic, there will be a return to these practices, so I think this is still relevant. So we did a stratified random sampling of 50 county probation departments. Illinois has 102. We surveyed the directors, and we looked at different regions in the state, north, central, and south, and we also looked at varying probation caseload sizes, so varying from smaller to larger. We asked 60 questions about demographics, policies, and procedures, the extent of testing done, how they administer tests, different test types they use, how they handle results and respond to those results. We had an 84 response rate with the 38 probation directors out of the 50 we were targeting. So based on the findings, 95% indicated drug testing was a part of the probation officer's job description, and 79% noted it was a mandatory duty. 87% indicated probation officers determined the drugs for which their clients would be tested, and this is kind of interesting that 32% said the judge made a determination of which drugs would be tested. So in terms of frequencies of tests, probation departments drug tested between 45%, and some actually said 100% of their clients. Two-thirds indicated between 80 and 100% of probationers were drug tested each year. Three-quarters of respondents indicated 10 to 40% of their probation officers' time was spent administering drug tests, though. It's a significant amount of time for officers. Administrations of tests, in terms of random tests, as you can see in the figure, over half said most of the time they were doing random tests. And 60% of probation directors reported clients were expected to take time off of work to provide a sample for their required drug tests. And half respondents said their clients did have some trouble getting off time for work to take their drug tests. So urine tests were most likely used, and that was followed by SCRAM, which is Secure Continuous Remote Alcohol Monitor. And then this figure shows ways that drug tests are tampered with most often overhydrating or urine substitution. And this figure shows the common drugs detected. Respondents reported the average price of a drug test was $8. And you can see marijuana, opiates, amphetamines, and cocaine were the most common across the board. So as seen in this figure, almost all respondents indicated their departments addressed initial positive tests and sporadic positive tests through a discussion with their clients. And that's supported by literature, as I mentioned earlier. Almost all continuous positive drug tests were addressed through a petition to revoke probation. "92% of probation departments responded to negative test results with praise, and 39% offered rewards, and these included things like vouchers or gift cards, reducing the number of court appearances, or moving to a less restrictive probation phase. So, overall takeaways, only 19% of probation departments always use random testing, and 25% never or sometimes use them. And as I noted earlier, random testing is recommended as the best method to detect drug use. Clinical addiction experts recommend randomly selecting the length of intervals to control the time between the tests. Probation officers should use drug testing to inform treatment guidance, which could greatly improve treatment efficacy by adhering to a random drug testing schedule. Though drug testing is recommended as a method for guiding treatment, our survey findings indicated an increased use of petitions to revoke probation following continuous positive drug tests compared to the initial positive drug tests. And this kind of shows a reliance on more punitive measures in response to drug use, especially continued drug use. This kind of practice can foster an us versus them mentality and threaten the cooperative aspect of drug testing and the relationship between the probationer and the probation officer. Prior research shows that patients who respond positively to drug tests view it as a treatment component and a way to guide their treatment process. By avoiding punitive responses to positive drug tests, probation officers can focus on treatment and motivating clients towards positive behavioral change. And I'll mention contingency management, which is a form of operant conditioning that emphasizes rewarding good behavior. And research has found significant evidence that contingency management interventions can effectively reduce positive drug test results. that. Just have some references. And here's my contact information. That's the end of my presentation. And I have another slide for us to have.
Thank you so much, Jessica. I'm going to invite our discussant, William Sabol, to take the microphone. And meanwhile, folks, if you have questions for our panelists, you can start entering those in the chat box. Bill?
Okay, do I have the microphone? The little ball's on Jason.
Oh, you do have the microphone.
Great, thanks. First, let me say I enjoyed these presentations, and I'm pleased to see the development of this empirical work on these issues. I'd like to classify my comments in two categories. First, I have some thoughts on each of the papers or the presentations, and most of the thoughts and questions kind of go towards future work that I think may have been alluded to in the presentations, but also have to address some issues that I'm ignorant about. And then after that, I have some general thoughts about this practice of R&R that hopefully we can have some discussion on. I'm going to start with the Georgia paper, and my comments may come in the form of questions. You can take notes, Sam and Steph, but you don't have to answer all of them, but when the discussion section opens up, you may want to comment on some of these things. So first of all, I was struck by a couple of things in the presentation. One is this concept of using a screener to select people to enter the DUI court versus, and the results from that versus the DUI court folk practitioners who are thinking they're not getting high-risk people. And you demonstrated that the DUI ramp would screen a lot more folk as high risk than the LSIR. But I wondered if that discrepancy between who might get screened in with a risk instrument versus who's actually in has to do with the fact that I believe the Georgia accountability courts still allow each person to make a choice to enroll or not to enroll. So with a high risk, a person screened as high risk being less likely to actually enroll in the court than somebody screened as low risk. And maybe that could explain why folk who are legally eligible aren't actually participating in the courts. But I think that issue affects sort of all drug or accountability courts, and that sort of post-screening selection issue. You know, to me it raises a big point about the extent to which these R&R or these practices should be based on, I don't want to call it completely voluntary cooperation, but a form of voluntary cooperation versus coercion. Okay, but a main point of your paper was to talk about efficiency, and a kind of that was couched in the terms of would an instrument that's designed specifically look at DUI, DWI, do better than a general risk needs instrument like the LSIR? And the answer is yes, it would screen better. But one of the things that your paper presented was this kind of debate within the R&R field about whether risks should be assessed separately from needs or risk and needs need to be assessed at the same time. And the debate kind of hinges on, well, what do you focus on? If you're focusing on a bevy of criminogenic needs and are trying to address them, then that can do a couple of things, reduce recidivism as well as facilitate reintegration, versus just focusing on risk and trying to address that specific problem. So your work kind of falls within that, what should you focus on? And as you develop this and perhaps write a paper on it, it'd be interesting to comment on that issue of what this research on the DUI ramp has to contribute to the debate of about whether or not that assessment should be a R&R or just R. Okay. Then on the efficiency issue, so I appreciated the cost comparisons and all that, but the first thing I thought about was, okay, it may be cheaper to use the DUI ramp, and that's great. But if you get large proportions of people who are screened into the court, is that going to increase the overall cost of the DUI court, both for case managers and what have you? And so is it actually, I don't want to say less efficient, but ultimately more costly to use an instrument like a DUI rant, which classifies more people as high risk? And I think you kind of alluded to the answer, which was you want to kind of assess the outcomes. Because if it is more costly, but it prevents recidivism down the road, then the benefits may outweigh the cost. But the first thing I was struck by when you introduced the concept of efficiency is you're looking at one part of it, which is just screening, and encourage you to look at the overall court efficiency and costs and benefits. Yeah, so good stuff. And then in general, just because it's a common concern about risk instruments is whether you have any information about how this has been, whether the DUI rant's been validated for different subpopulations, particularly by race or by gender. Okay. So with the Iowa paper, again, raised well, actually a couple of technical questions, but then a few other thoughts. First, starting with some of the findings that low-risk offenders who got services did worse than those who didn't. That's consistent with other studies of adult probation that basically says if you hassle low-risk people, bad outcomes can occur. But I was thinking about this issue, and I was wondering, what's the mechanism that actually causes low-risk people who get services to recidivate at higher rates? And because you can measure the services delivered, I didn't know if it'd be possible to kind of tease that out to figure out whether or not there are some particular services that are, I don't know, anxiety or frustrating producing, or whatever it would lead, whatever would be the source of causing the kids to have high recidivism rates given services. But backing up a bit to a couple of technical questions. So I always think about the juvenile recidivism problem in terms of 16 and 17-year-olds, and particularly in this case, 17-year-olds, where you're going to have right censoring on their outcomes because they're going to turn 18 probably within that year window, and just didn't know if you did any. By definition, they wouldn't be referred to juvenile court again, so didn't know quite how you handled that. And then given the longitudinal design that you described, I also didn't know whether you could enter services in your analysis as time-varying covariates, so you could measure sort of specifically when something was given and how that related to the recidivist outcome. But one of the two other bigger questions raised by the work were, it was discussed in the presentation about this is a tool, this isn't mandated, and it started me thinking about, well, how do you measure fidelity to the intervention? If the tool is giving guidance, but people have discretion, then how do you think about the fidelity of the use of this tool? And I can't say I have the answer to that question, but my job is to raise the questions, not give the answers. So, but also, if it's a tool with discretion, I think a more important issue is how do you assess and review the use of the tool and the decisions and the discretions to ensure that there's fairness and equity and you don't run into problems of unequal treatment. Okay. And then I kind of a third question in this area raised by your paper. Again, it's all good stuff. I wondered if when you were thinking about the outcome for low and moderate risk juveniles who got services, and that finding that low-risk folk who committed, I guess, a violent or sexual assault did worse. Are there any issues with the classification of risk that need to be addressed? And it was mentioned that that instrument was developed some time ago, but it struck me that, well, I don't know, maybe that there's an issue in risk classification, and that the services that are available aren't the right ones for the kids based on the risk classification. Again, don't know the answer to that question, but it just struck me as that. The other kind of thing that struck me was, boy, it seemed like the best thing to do based on your findings is don't give services to anybody except that group of high-risk offenders. And that's kind of like the safest thing to do. And I would like to hear your comments on that after I'm done in a few more minutes. Okay. And then turning to the Illinois study, I like this survey, and I like this study a lot. I like all of them, as I said. A couple of questions, though, that it raised were, and Jessica, you addressed at the end, was I was looking at rewards that were offered for negative test results, and there was only one, maybe two, I guess, that I would consider as behavioral. Like praise reminds me of participant medals, and I don't want to be cynical about that, but reducing reporting probation, that's behavioral. That's sort of like saying, I do this, I can actually see something. Or you mentioned the gift cards as rewards. Okay, that's something along those lines. And I think you also mentioned contingency management as others. So it got me thinking about kind of like the balance between rewards and sanctions in these models. And maybe because these are all operating out of criminal justice systems and we always think of punishment, the balance seems to be focused on more punitive actions, both for negative and on positive. It's kind of the absence of positive behaviorally based rewards. A couple other thoughts on this. When you mentioned the percent of time that probation officers spend doing drug tests, I was astounded at how much that is. But I wondered what training do the probation officers receive in, I guess, drug treatment, drug counseling? Are clinicians involved in any of these decisions? And just how is that process managed? And that got me thinking about maybe a way to integrate both the sanctions and rewards, and this, and whether or not this is something you could do through a survey like the one you wanted. But I was just wondering how much of the responses reflect available options in the areas, like the availability of services, the other treatment options, whether or not drug therapies are available for addicts and other kinds of things. So how much of the justice system response is constrained by these other aspects that focus more directly on treatment issues? But the other thing your paper did was got me thinking, as said, about the more general issues that I just want to raise a few. And you had a quote in there that about treatment needing to be not being punitive, needing to be based on improving the treatment principle, that it shouldn't be a punitive one, and essentially that treatment plans need to be assessed continually and modified as necessary to meet changing needs and those kinds of things. And it just brought together this idea that in all three examples and in this broader evidence-based and problem-solving approach that we have this, we try to bring together treatment and punishment. And the concern is, I'm going to quote Richard Bolt, who's written on specialty courts. He talks about the hydraulics of the treatment and punishment continuum. And it's a nice word because he's saying all the pressure when the criminal justice system is involved is to push things more and more and more towards punishment and less away from treatment. And if the issue is a drug problem or an alcohol problem that underlies DUI or drugs and alcohol for kids or just their general developmental for juveniles, they're where they are in the developmental process. And those suggest more like, well, a stronger public health or treatment focus orientation may be warranted than a punishment focus. And it asks each of you to think about where you think your states kind of fall on that, and whether or not you see the tendencies or the pressures to be pushing more towards punishment rather than the treatment side. So that's one kind of bigger issue. Another thing, just in general, I think you're all aware of like the controversies in the use of R&R and all these risk assessments. And one of them is the use of group averages to apply to individuals. Now, I know the argument goes that's what the insurance industry does, but the insurance industry doesn't care whether I die in an accident. It just wants to know how many people in my age sex group will die so it can set premiums. But when we're talking about individuals' lives and delivering justice and creating a system that's transparent and reviewable, there are some questions about how does that application of group averages work, and then if it's applied through the use of discretion, then we're back in the question of how's discretion reviewed and assessed to make sure that we have a fair system. To echo a point I made in some of the other comments, I would like to get some thought on whether risk and need should be assessed separately, and the value and advantages of that. I mean, obviously, if it's risk and need, then you're saying we're trying to assess the whole person and address underlying factors that certainly may be related to a specific type of crime, but also maybe focus more broadly on how to reintegrate them or integrate them into society so that all types of future criminal behavior are reduced. And then I think two more points. Another point, a lot of this work, particularly in the last decade, can be seen, and I know in George's case it was directly related to it, is tied to sort of the justice reinvestment effort, which basically says let's enhance supervision, try to reserve prison for, quote, the most serious, and then reinvest money. And I was thinking about this with particularly the Illinois case when I was thinking about, well, are the services available? And if not, how do they get funded? And it made me wonder, in the context of a JRI model, when we find that, well, actual savings are rare, and the way state budgeting works is if the prison population goes down, the prison department doesn't get more money, neither does anybody else, here in Georgia at least. But how do you fund these services when the savings are really cost averted and other crises, like I think Jessica mentioned, like COVID or come into play? How do we establish that sort of public health aspect of what might fall under the JRI issue? And then the final kind of issue for thinking about is, in all this, we're really experimenting with people. We're trying these things and testing them. And some of the results are sort of saying, well, increasing punishment or doing this, or trying these programs can result in increased punishments because of a kind of graduated sanction model, or if we could believe the most recent crimesolutions.gov report on Project Hope, it's not doing any worse, but it's costing more. And I just pose the question of how do we think about the ethical implications of experimenting in these contexts with vulnerable populations who obviously have lost liberty, when we don't have a lot of strong evidence that a lot of these things produce a lot of great benefits. So I'll stop there and I guess allow my presenters to give any responses that they want first and then open it up.
Great. Why don't we start with Sam? And I know that Bill gave us a lot to think about and a lot to answer, but in the interest of time, Sam, if you can pick some priorities and give us about 5 minutes of response so that the others have a chance to weigh in.
Yeah, so I'll try to go over the 3 main points really quickly that Dr. Sabol brought up. And I think the first one was about the concept of the screener selecting people versus the voluntary cooperation. And the DUI courts are really kind of interesting in the state of Georgia. They're post-adjudication. So a lot of times they are sentenced there without their not consent, but agreement, unlike all the other accountability courts. So it's kind of an anomaly with our Georgia accountability courts because it's post-adjudication. So a lot of folks in, though some courts do provide the opportunity to make the choice, but a lot of them don't, which I think is kind of interesting. But the goal of the accountability courts is to serve the higher risk and higher need individual. You know, so we really got to get a good sense of who these individuals are and if they are high risk and high need. And from my point of view, particularly for the accountability courts, I think it's really important to consider both, because the accountability courts is a pretty good level of supervision. You're going in, you're meeting with the judge all the time. You have all these people, requesting things of you. You're getting drug tests like supervision. There's a lot of stuff going on. You're under a lot of supervision. But the program is to address your needs. So, we want people that need to be under a lot of, a fair amount of supervision so that we can address those needs. So I think, my argument is that we need to look at both. I think if there are programs that aren't addressing the needs, maybe you can just look at risk and figure out, what level of supervision that they should be at. But if you have programming to address those needs, you definitely need to look at the needs. For the screening tool, it's not as important to address the needs because what we found all the time, but they have to have high needs, is what we found is that the treatment providers did a lot of other types of needs assessments to identify their kind of case plan. So that can come down the road, but as a screener, you definitely need to look at both. And the efficiency question is pretty interesting that you brought up, Bill. And one thing that kind of came to mind really quickly was the cost of getting, having low risk and low need individuals, maybe learning some things from their high risk and high need individuals, and where maybe they are going to commit something, now have the tools to do something worse, the cost of them being incarcerated. So that's the first thing I thought of. But to the point of that, maybe the self-selection or identifying the high risk and high need, I think the point with the LSIR was that the tool wasn't measuring what it was supposed to. So the courts are already, serving this high risk and high need. So maybe that higher cost for the high risk individual isn't there. But I'm thinking of the long-term cost for the low-risk individual who shouldn't be in this high supervision, high programming type of program, learning something and doing worse off than what they would have been doing if they weren't there, right? So that's a very interesting point. So I hope that kind of covered it.
Oh, yeah, thanks. We'll talk about this more, sure.
Great. Iowa team?
Hi, this is Kathy, and Jeff is actually going to answer a couple questions too, but I'll try to keep my response brief. Bill, you hit a spot for me that is very close to home when you asked about the low-risk kids and serving them, because I've been, as a result of research that we've done related to this tool for a few years now, I've been very vocal about the whole over-serving low-risk kids issue. What I will tell you in terms of when we, initially started looking at the matrix is that we weren't necessarily, we didn't need really to even pinpoint it to a specific service because it was pretty universal. But we do have the capacity to look in a little more closely at that, because we do have in our data system here, we do have a structure that allows us to look at different service types and to parse that out. So that certainly is something we could look at more closely. But what I will tell you is that we were seeing it kind of across the board, regardless of service. There wasn't necessarily one that jumped out more than the others. In terms of measuring kind of the fidelity to the tool, the way we're collecting the data now in the pilots and how I would envision it continuing in the future when we implement it statewide, we do ask the question, you know, of the person inputting the data, if what decision was actually made. So there's an entry point where they enter, did you choose the optimal, which is one of the possibilities within the box? Did you choose an appropriate option, which is another option that falls within the box? And then, or if it was outside of the box or outside of what would be a recommendation. And then we can potentially, you know, as things unfold, we can measure the recidivism, based on those decisions. So we'd be able to show the recidivism rate if you chose the optimal or appropriate options versus choosing something that was either too low or too high. And that's the way Florida has actually approached it.
That would be pretty cool. Thanks, Kathy.
Yeah, and one is a way, and I don't think we'll be able to go to the level of detail that they did in Florida, because they were actually able to do it down to a judge. You know, they could give direct feedback to an individual judge on, okay, these are the decisions you made and these are the recidivism rates. And they were able to show that when the decision was made to use either the optimal or an appropriate secondary option, that those recidivism rates were pretty universally lower than when they went outside the box. So, you know, whether they went low on the supervision or intensity of service or whether they went high, usually the recidivism rates were higher. So we would certainly look to pursue that. And then the other thing I'll comment on before handing it off to Jeff is you had mentioned kind of more broadly the issue of, you know, do we need to look at risk and need separately or together? And that actually is something that's come up for us in our discussions around the matrix. But one of the, as I talked about our assessment tool, the Iowa Delinquency Assessment, which largely drives the matrix, we do have the separate forms where we do the short form, which is risk level, and the long form, which is more case planning or need-based. So we have that separation a little bit, but in the same tool. But in terms of the matrix, and this is something that we'll be having in future discussions with our advisory team, is that, you know, when we do the supervision level, and then underneath each of those supervision levels is the services, those almost translate into risk and need. You know, so the supervision level addressing risk, and the services really are addressed more towards need. So we've been having conversations, and we'll have future conversations around the very issue you brought up, is it appropriate to lump those together, or should we be separating those out? So I guess I can't tell you that we have an answer to that question yet, but it's definitely an issue that's been kind of crystallized for us as we've been developing the matrix. So, and I'll let Jeff answer a couple the more technical questions you had.
Well, hi again, Jeff Regula here. I would echo some of what Kathy said about services. As I got into the data and looked across that, there really wasn't one that stood out as worse or better than the others. I think part of that was, at least from a data perspective, when you looked at that, you had a mix of risk levels involved in there as well. So I think one of the effects you saw on that was just high-risk individuals interacting with low-risk individuals, and sort of that learning that happens that we would rather not see along the way. On some of your more technical questions, you had a question about sort of the 17.5, 18-year-olds who are exiting a cohort. I should have mentioned this earlier. When we looked at recidivism, we were able to cross over into the adult system so that we were able to pick up new complaints in the adult system and tie those back to those kids as well. So that recidivism sort of crossed over that period so we could look at what happened in that. Your other question, which was sort of time from entry to time of service, that was not something I tried to incorporate into the models. It would be interesting. There was a lot of variability in that, as well as just from sort of time to decision, which varied, particularly as cases got more involved when they got more formal and got involved with the court. There could be quite a time between the complaint and the outcome, for example, and then maybe the onset of services. So while I think that would prove very interesting to look at, we weren't able to do that in what we had available for time in the analysis at this point, but would be something good to look on further in the future.
Great.
So that's kind of all I have.
Thanks.
Jessica, I want to make sure we have time to hear from you as well.
Okay. Well, to comment on some of the things Bill said, we didn't ask about the percent of time that was devoted to training for substance use disorders or on treatment, or how much counseling was involved in the drug testing, but that's certainly an interesting area that maybe should be explored. And then in terms of the balance between treatment and punishment and using a more public health model, I do think across the country and in my state, Illinois, there has been, especially because of the opioid crisis, real efforts towards combating stigma and training people on substance use disorders and towards more of a public health mindset, but I still think we have a long way to go. And then I know one thing that has come up is marijuana is now legal in Illinois, but I think probation officers are wondering what to do with that. Does that still mean I say they can't have any and would test for it? So that's sort of a new area to maybe discuss. But I'll just say to close, you know, I talked about how drug testing is so prevalent and it does take so much time, as Bill pointed out, and there can be so many negative consequences to it. I think it's really ripe for more research. I know there's lots of, you know, just doing this original study, which was, I just saw it as a first step to sort of get the landscape of the state, but then there's so many other things that could be explored, looking at outcomes based on who's getting drug tested and the results, and revocations that happen because of it, and even what would be really interesting is the qualitative piece where you're talking to clients about the burden of drug testing and their views on how helpful or harmful it is to be tested all the time. So I'll just leave it at that, but I think it's sort of an untapped area, again, to do some research because it's such a prevalent practice in probation.
If you do that, see if you can randomly assign probationers to their current condition of having to get tested to come up from work versus set up some testing sites so they could do it differently at a different time.
Yeah, exactly. That would be the ideal scenario, to be able to do it that way.
All right, I would like to thank our panelists and our wonderful discussant for such a thought-provoking set of presentations and reflections. Folks, thanks for staying with us. I know we're well over time. I'm going to turn it back to Dr. Sabol for just 30 seconds to see if he has any closing remarks.
Just reiterate what I said. I appreciate three really good presentations and papers. I've always learned that if papers don't spark questions, they aren't very good. Obviously, these spark questions, so they were good. So thanks.
Well, that's a wonderful thought to leave us on. Folks, remember you will be getting a copy of the recording and a set of the slides and any of the resources that our presenters mentioned today. So thanks so much for joining us today. And that ends this final session of JRSA's Fall Criminology Series. Goodbye, everyone.